One half of all women who try to conceive in 3 months of time. The remaining 85% conceive in 12 months of time. A concept called time to conception is evolving. The meaning of time to conception is the amount of time a couple take to conceive is called time to conception. Studies are showing that longer the duration of time to conception, more adverse events are happening to the pregnancy. In this episode of Alive newsletter, we'll be showing you some of the evidence. Joffe in 1994 in Fertil Sterility published an article titled Association of Time to Pregnancy and Outcome of Pregnancy, and he suggested an association with preterm birth, low birth weight, and higher risk of neonatal deaths. Later, Kaisa R indicated the longer the time to pregnancy, the less good obstetrics history and general health. Specifically, the occurrence of gestational diabetes increased from 6.5% to 9.8%, and similarly, the risk of placental previa, placental abruption, and chorioamnionitis also increased. The adjusted odd ratios for adverse pregnancy outcomes were found to be increased from 51 to 64% in women who had time to pregnancy of more than 2 to 3 years. Tehrani in 2014 published an article titled Relation between time to pregnancy and pregnancy outcome in a journal called Advanced Biochemical Research Overall, where he has emphasized the same concept. Axmon et al. In Fertil Sterility reported a significant relationship between longer time to pregnancy and ectopic pregnancy, and similarly to abortions, poor neonatal health, low Apgar score, low umbilical vein pH, and a higher need for neonatal intensive care were higher. The purpose of posting this blog is to emphasize the importance of time to conception, and couple who conceive naturally or through assisted reproduction who have longer time to conception should be considered as a precious pregnancy and possibly as an at-risk pregnancy, and look out for markers of early pregnancy loss, exclusion of ectopic, exclusion of intrauterine growth retardation, exclusion of placenta previa, and also greater care in the immediate 24 hours after birth, so that a precious pregnancy which has been obtained after a long period of sterility can be happily given back to the mother so that they lead a happy life after.